Hello, this is Kayla Sargent, and I'm going to be presenting our poster for our Peacock question. Our Peacock question was, what impact does ambulating within the first 3 hours after surgery have on the overall length of hospital stay for orthopedic surgery patients compared to those who do not ambulate after their orthopedic surgeries? So 35% of people aged over 65 fall, with 10% of these falls resulting in fractures. Patients who remain immobile have delayed recovery and are hospitalized for longer than 2 days, compared with patients who ambulate early postoperatively have been found to have earlier recovery times and decreased length of hospital stays. We looked at multiple references and multiple studies and found the similarity that early ambulation does decrease hospitalization and improve recovery times. For our nursing situation, we have Mr. John Smith, a 74-year-old admitted to the hospital after sustaining a right hip fracture. Mr. Smith has no previous medical history other than hypertension and hypercholesterol. He states he broke his left arm as a child but has not had any other fractures since then. The nurse comes to speak to Mr. Smith and his son prior to surgery to inform them that as to what they should expect post-operatively. The nurse reinforces the importance of treating pain and also ambulating after surgery. Pain and being able to ambulate go hand in hand with improving recovery and decreasing hospital stay. Patients over 65 account for the majority of hip fractures. This population is to double by 2030, and currently 300,000 hip fractures in the U.S. cost us over $9.2 billion. This is why we find our Peacock question so important. It's only going to get worse in the future if we don't make a change to how patients are expected to recover after surgery. Our project plan was to create a Peacock question where we had enough data to support our evidence. We evaluated the data from the research articles. We organized this data, and then we came up with recommendations and implications to improve hospital policies. So the implications of this are cost savings for Medicare, Medicaid patients, and the hospitals. Delayed mobilization following surgery has been associated with several complications such as pneumonia, UTI, thromboembolism, and delirium. We recommend from the research that we gathered, one of the things we looked at was hand grip strength prediction for early ambulation. Priority was patients should walk in the afternoon and the evening post-op day 0. So right after their surgery, they should already be starting to walk, or at least moving with physical therapy. Making sure they get a bed in the ortho unit, because usually these units have nurses with experience in orthopedics, ambulation, and they have increased physical therapy time. Make sure there is a post-op day 0 PT team that comes in on mid-shift to make sure these patients walk in the afternoon or evening. Often the patients after having surgery are going to need a little extra encouragement to be walking and gaining their strength back. Rather than what most patients assume is to just rest in bed, this is actually contradictory to positive healing experience. Steps for quality improvement. Each patient should be evaluated pre-op and immediately post-operatively as to whether they are going to be non-weight-bearing or weight-bearing. If patient is going to be non-weight-bearing, then appropriate equipment should be set up in the patient's room before arrival to the unit, such as a rolling walker, crutches, or cane. So a patient with a knee or leg surgery is going to have a different recommendation for post-op ambulation than a patient who had a wrist fracture or an arm repair. And the outcomes we found was length of stay evaluation over 3 months compared to length of stay over the last year in similar surgeries, was that patients who ambulated early did decrease their hospital stay length. Our methods for doing this is we communicated via Canvas messages, We conducted research via the library databases, and we put all of our information together through Google Drive. Below is our references, and hopefully with this question we can improve hospital policies and get patients moving faster and get them out of the hospital sooner. Thank you.